Here's a number I want you to think about for a second. 70. That's the percentage of Americans over the age of 60 who are currently living with high blood pressure. Nearly 7 out of 10 of you watching this video right now. And if you're one of them, or if you're trying to prevent getting there, I want to have an honest conversation with you today. Not a sales pitch, not a supplement ad, just real, evidence-based information that you can actually use. My name is Dr. Leonid Kim, and this is Senior Health Review, where we break down complex health topics into straightforward, practical advice for people who've earned the right to get straight answers. Today, we're talking about food, specifically 7 foods that have solid scientific backing for helping lower blood pressure naturally. Now, I want to be very clear before we begin. If you're currently on blood pressure medication, please don't stop taking it just because you're adding more spinach to your salad. These foods are powerful tools, but they work with your treatment plan, not instead of it. Always talk to your doctor before making significant changes to your diet. With that said, let's get into it. Stick around to number 7 because I think it's going to surprise you. Before we get to the list, I want to spend just 2 minutes explaining why food has such a meaningful impact on blood pressure. Because when you understand the mechanism, you're far more likely to actually stick with it. Blood pressure, at its core, is about 2 things: the force your heart pumps blood and the resistance in your blood vessels. When your vessels are stiff, inflamed, or constricted, your heart has to work harder and your numbers go up. Now, certain nutrients affect this directly. Sodium, which most of us get way too much of, causes your body to retain water, which increases the volume of blood in your vessels and drives pressure up. Potassium acts like a natural counterweight. It helps your kidneys flush out excess sodium and relaxes the walls of your blood vessels. Nitric oxide is a molecule your body produces that signals blood vessels to dilate, to open wider. Several foods on today's list are exceptional at boosting your body's nitric oxide production. Flavonoids and antioxidants reduce inflammation in your arterial walls, making them more flexible and responsive. This is why food isn't just a lifestyle choice, it's a physiological lever. And by the time you finish this video, you'll know exactly which foods pull that lever in the right direction. All right, let's count them down. Starting with the classics, and for good reason. Leafy greens like spinach, kale, Swiss chard, and arugula are among the most well-documented foods for cardiovascular health, and the reason comes down to one word: nitrates. Not the artificial nitrates you find in processed meats. I'm talking about the naturally occurring nitrates in plants. When you eat them, your body converts these nitrates into nitric oxide, that molecule I just mentioned that helps your blood vessels relax and dilate. A study published in the British Journal of Clinical Pharmacology found that dietary nitrate from vegetables significantly reduced systolic blood pressure, that's the top number, in people with hypertension. So how much do you need? Aim for at least 1 to 2 cups of leafy greens per day. Now, if you're thinking, that sounds like a lot, here's the practical reality. A huge handful of raw spinach wilts down to almost nothing when you cook it. 1 pan of sautéed spinach with a little olive oil and garlic, that's 1 serving, done in 5 minutes. If you're on blood thinners like warfarin, talk to your doctor about how much vitamin K, which is abundant in leafy greens, is right for you. The goal isn't to avoid them, it's to be consistent. The bottom line on leafy greens: cheap, widely available, and backed by decades of research. If you add nothing else from this list, add this. Who says healthy eating can't taste like dessert? Berries, and blueberries in particular, are loaded with compounds called flavonoids, specifically a subclass called anthocyanins. These give berries their deep blue, red, and purple colors, and they do something remarkable inside your body. A large observational study involving nearly 35,000 women found that those with the highest intake of anthocyanin-rich foods, primarily blueberries and strawberries, had an 8% reduction in the risk of high blood pressure compared to those who ate the least. 8% might sound modest, but for a chronic condition that builds over decades, it's meaningful. More recently, researchers found that regular blueberry consumption improved the elasticity of arteries, essentially making them more flexible and better able to absorb pressure. How much? Research suggests about 1 cup of blueberries, fresh or frozen, several times a week. Good news, frozen blueberries are just as nutritious as fresh and significantly cheaper. Don't let the price of fresh produce be a barrier here. Toss them into your oatmeal in the morning, which, not coincidentally, is food number 4 on our list. Nature's own prescription, already packaged together. Watch out for berry-flavored products, yogurts, juices, granola bars that have the flavor of berries but very little of the actual fruit. Whole berries or nothing. Now we're getting into territory that surprises some people. Beets aren't exactly the most glamorous vegetable, but from a blood pressure standpoint, they might be the most potent single food on this list. Here's why. Beets have the highest natural nitrate content of any vegetable. We're talking roughly 2 to 3 times more nitrate than most leafy greens. When you consume beets, that nitrate converts to nitric oxide rapidly, and the effect on blood pressure can happen within 2 to 3 hours. A 2015 study published in Hypertension, one of the top cardiology journals, showed that drinking about 8 ounces of beet juice daily for 4 weeks led to significant reductions in both systolic and diastolic blood pressure in patients with hypertension. Some participants saw their systolic reading drop by as much as 8 millimeters of mercury. Now, I know what you're thinking. Dr. Kim, I don't exactly have beet juice on my shopping list. Fair enough. Here are some practical options. Roast beets and add them to salads. They take on a sweeter, earthy flavor. Pre-cooked beets come vacuum-sealed at most grocery stores, no preparation required. Beet powder can be stirred into water or smoothies. And yes, beet juice. Just check the label and avoid versions loaded with added sugar. One caution, beets are high in oxalates, so if you have a history of kidney stones, check with your doctor about how much is appropriate for you. And don't be alarmed if your urine turns pink. It's harmless, and it has a name, beeturia, completely normal. Let's talk about breakfast. If you're not starting your morning with oatmeal, you might want to reconsider. Oats contain a specific type of soluble fiber called beta-glucan, and this fiber does something very useful for your cardiovascular system. Beta-glucan forms a thick gel in your digestive tract that slows the absorption of cholesterol and sugar. Over time, this reduces LDL cholesterol, reduces arterial inflammation, and, directly relevant to today's topic, lowers blood pressure. A meta-analysis published in the American Journal of Clinical Nutrition reviewed 28 randomized trials and concluded that oat beta-glucan significantly reduced both systolic and diastolic blood pressure, with the greatest effects seen in people who were already hypertensive. The target amount for cardiovascular benefit is about 3 grams of beta-glucan per day, which translates to roughly 1.5 cups of cooked oatmeal. Important tip: we're talking about rolled oats or steel-cut oats, not the instant flavored packets that come loaded with sugar and sodium. Those essentially undo everything you're trying to accomplish. Plain oats, topped with fresh berries and a small drizzle of honey, you're stacking 2 foods from this list into one meal, and it takes less than 10 minutes. This is one of the most senior-friendly foods on our list. It's filling, it's gentle on digestion, and it's inexpensive. There's a reason oatmeal has been a morning staple for generations. Let's talk about something you probably already have in your kitchen. Bananas are one of the best natural sources of potassium, with a medium banana providing about 400 to 450 milligrams of this essential mineral. And as I mentioned at the start of our video, potassium is your body's natural counterweight to sodium. Here's the mechanism. Your kidneys are constantly trying to maintain a balance between sodium and potassium in your bloodstream. When you eat too much sodium and too little potassium, which describes the diet of most Americans, your kidneys retain fluid, your blood volume rises, and your pressure goes up. When you increase potassium intake, your kidneys excrete more sodium, blood vessels relax, and pressure comes down. The American Heart Association recommends adults aim for about 4,700 milligrams of potassium per day. The average American gets about half that. One banana isn't going to get you there alone, but it's an easy, portable, affordable contribution. Pair it with other high potassium foods: sweet potatoes, beans, avocado, and the leafy greens we already talked about. One important note for my viewers: if you have chronic kidney disease, high potassium can actually be dangerous for you because your kidneys may not clear it efficiently. This is one of those situations where you absolutely need to discuss dietary potassium with your doctor before increasing it significantly. For most healthy individuals over 60, though, a banana a day is a simple, delicious habit that supports heart health. We've arrived at what I consider the most underrated food on this list. Garlic has been used medicinally for thousands of years across dozens of cultures, and it turns out a lot of that traditional wisdom was onto something real. The active compound in garlic is called allicin. It's what you smell when you crush or chop a clove. Allicin triggers the production of compounds that relax the smooth muscle in blood vessel walls, reducing vascular resistance and lowering blood pressure. A meta-analysis published in the Journal of Human Hypertension looked at 12 randomized controlled trials and found that garlic supplementation reduced systolic blood pressure by an average of 8 millimeters of mercury and diastolic by 5.5 millimeters of mercury in people with hypertension. Those numbers are comparable to what some blood pressure medications achieve. Now, there's a catch. The form and preparation of garlic matters. Fresh, crushed, or minced garlic is your best option. When you crush garlic, you activate the enzyme that produces allicin, so always let it sit for 5 to 10 minutes after crushing before you cook with it. This maximizes the allicin content before heat partially breaks it down. Garlic powder has some benefit, but significantly less. Aged garlic extract in supplement form has shown strong results in studies. If you don't love the taste of raw garlic or worry about the smell, this is a reasonable alternative to discuss with your doctor. 1 clove to 2 cloves of garlic per day in your cooking is a realistic, easy, and frankly delicious target. Sauté it with olive oil and toss it over your leafy greens, and you've just created a meal that's doing real cardiovascular work. I saved the best for last. Yes, chocolate is on a doctor's list of foods that lower blood pressure. But before you grab a Snickers bar, let me explain exactly what we mean. We're talking about dark chocolate, 70% cacao or higher. Not milk chocolate, not white chocolate, dark chocolate. The reason is flavanols, a specific type of flavonoid found in high concentrations in cacao. These flavanols stimulate the production of nitric oxide in the lining of your blood vessels, the same mechanism we talked about with leafy greens and beets. A systematic review in the Cochrane database, one of the most rigorous sources of medical evidence, analyzed 35 trials and found that flavanol-rich cocoa products led to a significant reduction in blood pressure over the short term. The recommended amount? About 1 to 1.5 ounces of dark chocolate per day. That's roughly 1 or 2 small squares. This is not a license to eat half a chocolate bar. The calorie and sugar content still matter. Look for bars that list cacao or cocoa as the first ingredient, and check that the sugar content is low. The higher the cacao percentage, the more intense the flavor. 70% is a good entry point if you're new to dark chocolate. 85% gives you more benefit with less sugar. Think of this as your end-of-day ritual, a small square of dark chocolate with a cup of herbal tea. That's not a guilty pleasure, that's a prescription. Alright, let's make this practical. Here's what a realistic day of eating looks like when you're incorporating these 7 foods. Morning. A bowl of plain rolled oats, about 1.5 cups cooked, topped with a handful of fresh or frozen blueberries. A banana on the side, black coffee or herbal tea. Midday. Lunch. A large salad with 2 cups of spinach or mixed greens, topped with sliced roasted beets. The pre-cooked kind from a package works perfectly. Dressed lightly with olive oil, lemon juice, and, you guessed it, a clove of minced garlic in the dressing. Dinner. Your protein of choice. A side of sautéed kale or Swiss chard with garlic and olive oil, or a simple roasted beet and sweet potato side dish for extra potassium. Evening. Optional snack. 1 to 1.5 ounces of dark chocolate, 70% or higher. A small handful of berries if you'd like something sweet alongside it. Now, I don't expect anyone to hit all 7 foods every single day. Life doesn't work that way. But if you can incorporate 4 or 5 of these consistently across your week, you'll be doing something genuinely meaningful for your cardiovascular health. And remember, consistency beats perfection, every single time. We can't talk about foods that help without briefly mentioning what works against you, because it doesn't matter how many beets you eat if you're also consuming things that are silently pushing your blood pressure up. Number 1. Hidden sodium. This is the big one, especially for my viewers over 60. The American Heart Association recommends no more than 2,300 milligrams of sodium per day for most adults, and closer to 1,500 milligrams for those with hypertension. The average American gets well over 3,400 milligrams. And here's what catches people off guard. The worst offenders aren't the salt shaker on your table. They're packaged and processed foods: bread, canned soups, deli meats, frozen dinners, condiments. A single can of soup can have 800 to 1,000 milligrams of sodium. Bread can have 150 milligrams per slice. Start reading nutrition labels. Look for products labeled low sodium or no salt added. Cook more at home where you control what goes in. Number 2. Alcohol. More than 1 drink per day for women or 2 for men can raise blood pressure and interfere with blood pressure medications. If you enjoy a glass of wine occasionally, that's likely fine, but it's something to be mindful of. Number 3. Excessive caffeine. The research here is somewhat mixed, and most healthy adults can handle moderate caffeine without significant blood pressure effects. But if you're sensitive to caffeine, or if you notice your readings are higher on days when you've had multiple cups of coffee, it's worth experimenting with cutting back. Let's bring it home with a quick recap. The 7 foods we covered today. 1. Leafy greens, your daily non-negotiable. 2. Berries, nature's anti-inflammatory dessert. 3. Beets, the most nitrate-dense vegetable on the planet. 4. Oats, your heart-healthy breakfast anchor. 5. Bananas, portable potassium every day. 6. Garlic, ancient wisdom proven by modern science. 7. Dark chocolate. Yes, really. My recommendation: don't try to change everything at once. Pick 2 or 3 of these foods that you already enjoy or that seem easiest to incorporate and start there. Build the habit, then add more. Small, consistent changes in your diet can move the needle meaningfully over weeks and months. I've seen it in patients, I've seen it in the research, and I know it's possible for you. Before I go, I want to hear from you. Which of these foods are you already eating? And which one surprised you the most? Drop a comment below, I read them, and your response might even inspire a future video. If you found this helpful, please consider subscribing to Senior Health Review. Every week, we cover health topics that matter to adults over 60, without the noise, without the ads, just honest, doctor-reviewed information. And next, I'd encourage you to watch our video on the DASH diet, which builds on everything we talked about today into a full eating framework designed specifically for blood pressure management. Until then, take care of yourself, and let food be one of the tools you use to do it. I'm Dr. Leonid Kim. I'll see you in the next one.